Hi, Meg.
Hey, Victoria.
So, can you introduce yourself, what you do for a living, and share your experience with endometriosis, starting before you even knew you had endometriosis, first symptoms that you had, how many doctors and specialists you had seen? I know you were diagnosed in 2015, but it had taken 10 years to get to that. So,
Yeah.
please share with us how that was for you and a little bit more in the beginning stages.
Sure. So from the first time I got my period, I was in 7th grade and it was horrendous. I went to a private Catholic school, so I was wearing a uniform. I couldn't decide what outfit I was wearing that day. And unfortunately, many times at school, I ended up having to leave because of accidents that I had. And I realized, at that age, none of my friends were having this problem. So I told my parents, because I was only 14 at the time, I said, I feel like something's off. Let's just go see a doctor, because my mom also had issues with her cycle as well. Don't worry. So she also had issues with her cycle. And that's what at first I thought that was normal. But then when I saw that my friends weren't having the same thing, I realized that wasn't normal. So the first time I went to an OBGYN, I was 14 years old, which is very young.
Yeah.
They told me, oh, just come back next year. Everything's fine. This is just normal. Fast forward, my symptoms were getting worse and worse as years progressed. And, I went to 7 OBGYNs, multiple other different types of specialists, because I was having a whole range of symptoms, not just pain during menstruation, but I had pretty much every symptom in the book. GI issues were a big one for me. I tried every different diet and lifestyle, like veganism, anything that would try and reduce the inflammation in my body. I didn't know what I was doing at the time. So fast forward again, I finally found, after the 7th OBGYN, 10 years later, a doctor that told me, there's some noise. Sorry. Okay, I'm going to start over again. So after 10 years of searching for answers, I found a doctor that told me that they thought I might have had endometriosis, but the only way they could clinically diagnose it was through laparoscopic surgery. So when I got that news, it was really a relief for me, but also I was scared because I had never had a surgery before. What if when I had surgery, they weren't going to find anything, and then I was still going to be going on with my life. I ended up rupturing an endometrioma so severe that I was rushed to the hospital, so I scheduled surgery right away, and they found late-stage endometriosis, so I was 23 years old. It took me 10 years to get diagnosed.
Wow.
That's the average amount.
Yeah.
The average amount is 10 years.
Yeah, I was reading that. And, endometriosis is something that I treat, but there's definitely a gap between why practitioners or why these symptoms are getting missed so early on, that it's taking so long for patients to get diagnosed. Was there, in your experience, did you find that there were other conditions that they were considering, or no?
Absolutely. I got diagnosed with IBS multiple times, which was why I tried so many different diets and lifestyle to help heal my gut. But when they went in for the surgery, they actually found endometriosis on, besides, the uterus, fallopian tubes, ovaries, pelvic floor, pelvic area. It was on my rectum and colon, which was causing a major amount of, food intolerances, inflammation, bowel issues, that actually, when I had my incision surgery, a lot of my food sensitivities were gone. So I went 17 years without dairy, but I was able to eat cheese again for the first time, and I couldn't even recall. So it was pretty amazing. And I didn't have IBM. It was just a misdiagnosis.
Wow. And yeah, the constipation GI issues are definitely pretty common. Do you know if, assuming the uterus is the most common place, but after that is typically the rectum and colon that get affected?
Many patients, I don't know the exact statistic, but many patients that go in for an endometriosis surgery typically have endo in other areas in their peritoneal cavity outside of other than the uterus. It's very interesting. This is a statistic that I can share. that endometriosis has even been found in a fingertip.
That's crazy.
Mm-hmm.
Yeah.
Yeah. So typically what happens is it gets more severe, it travels up. So mine, I had it all over my appendix. So I had an appendectomy during my surgery as well. And it was going for the liver, but I have some friends that had, diaphragm thoracic endo.
Yeah.
So you have to go to a specialist for that.
Yeah. Wow. I didn't realize it go all the way up to your fingers.
Yeah.
That was crazy.
Mm-hmm. It's wild.
Wow. Okay. So, how you said that the GI issues resolved after you had the excision surgery. How did you feel otherwise, though, as far as like pain and effect?
Like a new human. Like, I literally, the first time I got my period after surgery, typically the surgeons will tell you, oh, it's going to be a very painful period. I cried out of joy because I was able to function on day 2. I didn't know if it was going to work, but when I was get in the recovery room after surgery, I felt it, like, in my soul. I was like, this worked. Recovery was tough. But we'll get into that.
My next question, how was the recovery for you? How long did it take for you to feel, obviously not where you were before surgery, which wasn't in a good place, to feel more like yourself again?
Well, it was very interesting. And I'm glad that you're asking this question because I get this question a lot. Excision surgery recovery is very tough, but it is the most worth it surgery recovery that you can experience with endometriosis surgery because typically, your standard endometriosis surgery that most OBGYNs are taught in school is you do ablation, they cauterize it, and then we'll see you in 2 years for another surgery. But obviously that's not sustainable. Because it creates more scar tissue, which is what the disease feeds off of, and then the endo goes back faster. But with excision surgery, it cuts to the root of the disease, and so the retention rate is significantly lower. But because it cuts to the root of the disease, it's a tough recovery. I mean, when I was going through it, and I love this stuff, so I watched my whole surgery on camera. I have the whole recording on a hard drive, and they
That's
are
awesome.
ripping, not just like, oh, it's so awesome. I'll send you pictures. They're ripping giant pieces of tissue off of my peritoneal cavity. Even areas where there weren't like actual lesions, they were taking the tissue off because they had this technology that could show early stages of endo. So like you could see it kind of under the tissue that it's going to pop out. So they removed that too. So for me, I'll be raw and real here and you can share whatever you want to share, but I stayed overnight in the hospital so I was in the hospital for about 36 hours. I was in no way able to leave on an outpatient basis that day. It was just not happening. But I had to use a bedpan to urinate when I came home for 5 extra days because I couldn't walk to the bathroom. And the bathroom was 10 feet away from where I was recovering. I did the recovery of about 5 days. I was able to kind of move around and walk and use the restroom. And then around 3 weeks after the procedure was when I was able to like function again. But I had to be very careful with how I did things. So the recovery, I would say I could function in society again at around 3.5 weeks. But I didn't feel 100% better, like zero random surgical pain for about 2 months. But everyone's different. Some people recover in a week.
Yeah.
Some people recover in a few days. Some people recover in 2 months. It depends on your case.
Right.
And the skill set of your surgeon. Everything is, this disease is so unpredictable that it really just depends on the patient.
Mm-hmm. I'm actually shocked to hear that it was 2 months. I was expecting longer than that just because from the orthopedic standpoint and the surgery is a little bit more complex because they're dealing with so many different organs.
Yeah.
That I would have thought it would have taken like a year. Mm-hmm. But that's amazing. And it is also laparoscopic, so that makes a difference. Mm-hmm. But it's amazing that felt really pretty early on. Mm-hmm. Obviously beginning like 8 weeks, I'm sure we're very full but
I remember when after I recovered, I was working in Manhattan, but I was living on Long Island, so I was commuting. And I remember when I was at home and around, like I could function and then everything was fine. But at like 7 a.m. when I'm walking from the train to my office, I would feel it like in my pelvic floor. I feel like it wasn't like a sharp pain where I was like in agony or anything.
Yeah.
I didn't even have to take Advil, but I just felt it. I don't know how to describe it. Surgical pain is a very unique type of pain that is vastly different from, the illness pain, if that makes sense.
Yeah. Do you feel like a heaviness or a pressure because of like all the swelling and inflammation that can happen after the surgery?
Yeah, within the week, yes. But that went away. That actually went away. So they prescribed you an antibiotic, to just take for, a few days, because I did have a catheter as well. So they do that for, precautionary purposes. And I was bloated like crazy from the antibiotic that I actually requested to cut it off early, which they did approve. And so with that, I did have some pressure, but honestly, it wasn't bad.
Yeah. To your point about different types of surgery, ablation versus laparoscopic, why do you think that some doctors do go for the ablation versus the laparoscopic surgery that will really get to the root of the endometriomas and then get it out and get the, management of endometriosis better?
So it all comes down to education. I hate to say it, but ACOG, this is what they teach, is they pretty much teach that, the treatment for endometriosis is ablation surgery. That's just how it is. So, it's a laparoscopic procedure, but instead of excising it, they're cauterizing it. That's just what they're taught. So a lot of what we do in the Endometriosis Coalition is we promote awareness and reliable education for proper treatment of the disease. So unfortunately, though, what it's still an uphill battle is ablation is covered by insurance, whereas excision surgery is out of network. So that's actually something that we work on as well to try and, create grants for patients who either can't afford a consultation or need some help for transportation to an excision specialist that actually specializes in endometriosis surgery where they do excision. So, that's some things that we work on. It comes down to education, because think about it. I went to 7 OBGYNs, not a single one mentioned endometriosis to me. What they learn is like a small chapter in a book.
Yeah.
And this is something that we're trying to work towards to change.
Yeah. And it's, similar to my field, there is definitely a lack of education with pelvic floor therapy.
Yes.
It's something that I've noticed that their training does not include pelvic floor, like just going through like conditions, symptoms, anatomy, all of that. I'm sure they have some anatomy, but the ways that referring can actually improve the symptoms that you're having, so they're not continuously coming to the doctor with, false UTI tests and, pelvic pain, sex. So there's definitely more education that's needed.
Mm-hmm. Absolutely.
So I know that you recently had surgery over the summer to get your uterine fibroid removed. Mm-hmm. How did that go? How are you feeling? What was the symptoms that you were having between your excision surgery up to then that was maybe a little bit different than the symptoms that you were having before the excision surgery?
So the fibroid surgery was a walk in the park in comparison to my endometriosis excision surgery. Partially because I had what they call a submucosal fibroid. So a submucosal fibroid is a fibroid that's it's in the uterine wall, but it's protruding into the uterine cavity. So they can properly treat it through a hysteroscopic procedure, which means they go literally through the cervix, and then they just remove it that way. So actually the hardest part of my recovery was recovering from the anesthesia, as opposed to recovering like pain wise. I didn't even bleed that much. I didn't have surgical pain. I didn't take medication a single time. I think that one thing that happens to me though, and it's a very normal thing that happens to people that undergo general anesthesia, is they wake up in the recovery room, they black out, they say things they don't remember, and then they go back to sleep. And I think I might have asked for medication when I was awake.
Right.
But because when I really woke up, like when I was conscious in the recovery room, they said, do you want more? And they gave me like a pain med. And I was like, no, I don't have any pain. I don't need this. It's fine. So my recovery was very easy. I was actually on a plane 6 days later.
Wow. Mm-hmm. Big difference.
Very big difference. I mean, I was walking around, like I walked out of the hospital after my procedure. They wheeled me to my dad and my husband, and then I walked out of the hospital. Whereas with the other place, I couldn't even take a step when my parents took me home. I couldn't even take a step. Yeah. It was tough.
Well, also just such a huge difference in what they were removing, a fibroid versus how many endometriomas,
exactly,
and, cysts or anything else, like compared to what you had in the first one.
Exactly. But what I did experience, just to cover that other part of your question as well, from the fibroid, that was a big problem for me, was excessive bleeding. Fibroids cause extremely heavy bleeding during menstruation and clotting. So what I did notice after, and I'm really grateful for this, is that I'm not experiencing the clotting that I had prior to the procedure. They also noted that because of the location, so it was protruding into the uterine cavity, but it was also actually blocking one of my tubes. So they thought that might be a cause of infertility as well. So that's something that we're working through to figure out.
Yeah. Well, I'm glad that this was a smoother surgery.
Yeah. Literally on a plane 6 days later to a conference in Indianapolis. But, we do what we can.
I know. What are some non-surgical treatments that worked best for you? What didn't work best for you? Anything ranging from diet. I know that you had some experimentation with that. You're now doing an ancestral diet. To supplements, to exercise, meditation. Yeah, talk to me about
this is my favorite topic. I love this. So previously, a couple years ago, I was actually more plant-based. So I've been vegan, I've been vegetarian, I've been pescatarian. Like I mentioned before, I went 17 years without dairy. So I've tried a lot of different things to manage my symptoms. What worked for me was actually a year and a half ago, I made a complete lifestyle change. I wouldn't even call it a diet. It's really a lifestyle where I'm not eating any processed foods. And everything is organic, but I can control it, right? So lots of meat, lots of red meat. I have raw dairy, which is a controversial topic, but it's really changed my life. Lots of eggs, raw honey, fruit. I actually don't eat a lot of vegetables, which is really controversial for a lot of people. But, if vegetables work for you, that's great. For me, it causes gut dysbiosis. So it's not something that I don't do that much. But also, besides the food part of it, I've removed a lot of endocrine disruptors from my household. So I've switched out my cleaning products, my laundry detergents, to be more of a non-toxic products, which we don't realize how many endocrine disruptors we're exposed to each day. I mean, it's in our clothing. And listen, you control what you can control. But clothing, makeup, cleaning products, food. So if it's coming out of small angles, we have to do the best we can to control what we can control. And for me, when I made this lifestyle change, I noticed a really significant difference very quickly.
It's amazing. Something as simple, not simple, I'm sure it's a lot of research. It's also, you're constantly then looking at the ingredients of everything, but making that change really makes a difference for you. Yeah. And also be the difference with managing the PCOS as well. You mentioned the endocrine disruptors and, endocrine issues is something that also can be found with endometriosis. Was that something also that you have been monitoring or something that also has come about?
So this is the way I see it. Hormone health, everyone has to have hormone health, not just endo patients, not just PCOS patients. We as human beings, especially as women, because we're not on a 24-hour cycle like men, we're on average 28-day to 30-day cycle where we have different phases. So we have to make sure that, we do the best we can for our hormones to be balanced at whatever point in time our cycle is. So endometriosis patients and PCOS patients and people with fibroids all deal with hormonal fluctuations just based on the fact that the disease just causes those things. So I do believe that it is, for us patients, it is more important for us to be a little bit more in tune with what we're putting in our house or, with what we're putting in our bodies. But like I said, everyone can benefit from just doing the best they can to reduce their toxic load, as best as they can control it.
Yeah, no, that's so true.
Yeah.
As a specialized pelvic floor physical therapist, my specialty is not to cure endometriosis, but I can help to manage symptoms. So I see patients that I'm helping them with pain with sex, pelvic pain, when they're having flare-ups as well. Is this something that you have ever done, considered? Is this something that doctors mentioned to you? Or did you kind of find out about it on your own?
So thank you for sharing that, because a lot of the patients that I speak to are actually in pelvic floor physical therapy. I always tell them that, if you have any sort of, because, there's I don't want to call it a comorbidity because I don't think it really is a comorbidity, but vaginismus, am I saying it right? Vaginismus. Yeah. A lot of endo patients suffer from that. I'm very fortunate that I haven't, suffered from, vaginismus. But it is a very common thing. I personally have not yet tried pelvic floor physical therapy. I don't think that I needed it, but you know what? I don't want to say that because I think that anyone can benefit from a treatment that helps the disease that they have. So I hope to actually try it.
Yeah.
I think it's actually, and you can talk more about this, but does it help women who have recently given birth kind of just like bounce back too?
Yeah. So there's a big benefit with the postpartum stage, even during the pregnancy stage too, getting your pelvis and your pelvic floor ready to give birth, even if it's going to be cesarean delivery.
Right.
But postpartum especially, there's so many changes that happen to the pelvis, in terms of how the joints are. There can be sometimes misalignments, or they can be a little bit more of an open position. So there's definitely a benefit to seeing a pelvic floor PT and seeing how is your pelvis aligned? How are your abdominal muscles connecting? How are you connecting your pelvic floor to your core?
Right.
Is there tension in your pelvic floor? Is there scar tissue from the perineal and the scar?
Right.
Or is the cesarean scar, pretty rigid and stiff and painful? Those are things that I work on with patients all the time. But going back to what we were just talking about, having 2 surgeries, now one that was very serious, they were both serious, but one that was a little bit more intense in terms of how much they did. There's definitely a benefit when getting someone to look at your abdomen, look at your pelvic floor, because even though they're taking out scar tissue from the endometriomes or endometriomas, there's also scar tissue that can develop from just getting the surgery itself.
Exactly.
Which then can also play a part into what flows to those organs, which you need, obviously. And there's definitely a benefit to getting evaluated and seeing how that is for you, because you may not even realize it until you get the evaluation.
You're so right, because, and I didn't know about this back then. So my surgery was in 2015. Remember when I mentioned that I was walking from the train to the office, I would feel surgical pain? The only place I felt surgical pain was in my pelvic floor.
Yeah.
And I think about it, I'm like, I so could have benefited from like a post-surgical treatments.
Yeah.
I just didn't know about it. Yeah. I had no idea.
Yeah. So that's a great point.
Yeah.
The pelvic floor, and I wish I had my model here to show you. You can think of it as it's a bowl. Mm-hmm. So when you have your big pelvic bones, you have your pelvic floor. It's not just one muscle. It's actually 20 different muscles that give you that support for your pelvic region and for all of the organs that are on top of it. Your bladder, your uterus, your rectum, your colon, small intestine, everything. So when, you mentioned that you're feeling the pressure of everything, it completely makes sense, because that's your pelvic floor that's trying to stabilize as you're, recovering from the surgery and all of the inflammation that you are still experiencing.
100%.
So getting evaluated to see how your pelvic floor is functioning would be really interesting and super important. I'd love to find someone that, can evaluate you, but there's definitely benefits,
I love that.
Post-op and pre-op. One of the areas that can be truly devastating due to the pathophysiology of endometriosis is issues with fertility. Do you mind sharing your experience with fertility, and if this was something that was discussed with you and with your doctors from the time of being diagnosed and to currently where you are?
Absolutely. I'm very comfortable sharing about this topic. So very interesting. When I was diagnosed with endometriosis in 2015, I was dating Albert, my husband, but we didn't know, like, I was still living in New York. Our relationship was very new. So we were together for around a year and a half. When I had my endo diagnosis, it was actually like a very critical point in our relationship, because at that point I had to decide, like, okay, I'm trying to preserve my fertility as a 23-year-old female with the disease that I think I might have, but I don't know yet because I haven't had the surgery yet. It's a top 3 cause of infertility in women. So I don't want to say forced, because I don't like to say that, but I really was. I was forced to evaluate my fertility at 23 years old when I was with someone who wasn't my husband. I loved him very much, but I still didn't know, like, it was so early on. And, I'm grateful for it now, because it made me be very in tune with, what was to come with my life and just the reality of the disease. So when I had the surgery, my cycles were so extremely healthy that my surgeon at the time was like, "You're going to be great." Still my surgeon, by the way. I don't know what I said at the time. Everything's going to be great. But I was still living in New York. I hadn't lived in Florida yet. And the disease can come back. It is a chronic illness. So fast forward to, we got married in 2019, and we didn't start trying right away because life happened, the pandemic happened, and my husband is in the entertainment industry. So, financially, we just had to evaluate certain things, and we didn't start trying until, and I don't usually like to use the word trying. I just kind of like give it up to God situation. If it happens, great. And if it doesn't, that's okay too. In 2021. But at the end of 2021, I started noticing issues with my cycles again. So then I got very frustrated. I wasn't frustrated at the fact about, okay, I'm not getting pregnant, but I was frustrated more of, okay, I have to evaluate my health first, because my health first and foremost has to be as good as I can have it in order to carry a pregnancy to term and have a healthy baby, right? So 2022 rolled around, my fertile window was getting short again. And so I had a feeling that my endometriosis was coming back. And fast forward, they found a very large endometrioma on my left ovary, which is when I made the radical lifestyle changes to address that. So will I have another endometriosis surgery? It's very possible. Because although with diet and lifestyle, I have had the endometrioma shrink very significantly. So it went from the size of a Y on my left ovary to around the size of an almond. But the last time that I had it measured was about 6 months ago. So I don't know the size, even though I don't feel physical pain. But what I do know with the science of this disease is that if there's a large endometrioma, then there's more than likely you have the disease again in the cavity. So, will I have an endo surgery again? It's very possible. Which, I felt like I had many years to kind of mentally prepare for this, fertility journey that could be very easy or very not easy. People with this disease, some people don't have problems at all. Some people have surgery and then they get pregnant. Everything's great.
Yeah.
Some people have to try a bunch of other things. So we do actually have at the Endometriosis Coalition what we call virtual support groups. So we meet once a month. I'm actually not part of it. just because to respect the space as, the associate director of the organization. We have a licensed therapist and she manages the virtual support group. So it's once a month, typically on the last Thursday of the month, where people talk about, their struggles, whether it's I'm losing all my friends or I can't have a baby. Like, we cover all of the topics because the feelings are valid. It's not an easy journey.
Yeah. And even though it's just a medical condition, it affects you emotionally, like your relationships. Mm-hmm. And, when you initially got diagnosed, you were at such a
I was 23.
Pivotal point in your life, figuring out career and this new relationship that you're in. So I'm sure it was like a lot for you to take on. Yeah. From an emotional standpoint. And you're doing all of the things, the dietary to feel good. So, I wish you the best of luck with that. Thank you so much for coming on here and discussing your experience and sharing so much helpful information, advice, and just insights on how you went through this and how you're still going through it. Is there any advice or, information that you want to give to women that are going through the same journey as you?
Absolutely. My number one advice is to be your own advocate. Because unfortunately, many times when I was going to the doctor trying to find answers, I wasn't getting the answers I needed. I felt like I was being dismissed. Oh, your periods are normal. Oh, you're probably just making it up. And you know your body better than anyone else. So if you know something's not right, don't stop until you have an answer.
Yeah.
Be your own advocate.
No, that's so true. In every aspect with any sort of medical issue, but especially this, because this was something that you were dealing with for so long and didn't get an answer until 10 years later.
Yeah.
So no, I just
it's still recording.
Oh, okay. Yeah. Well, again, thank you so much.
Thank you.
And, this is going to help so many women that either are in the stage of trying to figure it out or have the diagnosis and are still, going through everything. So
thank you, Victoria.
Thank you.